So for today's video, I'm going to share with you some new patient exam ideas to really make the new patient experience great and to help you with new patients. This is really important because new patients, especially if you're marketing for them, can be very expensive to get in the door, and you want to do it right. I'm Dr. Sahil Trivedi. I'm a speaker here at MGE. I'm also a practice owner who has my own offices, and I apply these tips myself. So when it comes to new patient exam, I think the first thing I want to start with is have a clean operatory. One of the things I would suggest to dentists is actually look at the office from the perspective of a patient. So actually sit in the chair, lean back, look everywhere, and see what the patient's seeing. That's your first impression, and you want to nail it, right? So after that, I'm not going to talk to you about how long it takes you to do a new patient exam. That varies dentist to dentist, but I am going to say it must be thorough and it must be comprehensive. You want to get all the data that you're going to need to come up with a comprehensive long-term treatment plan that's going to make this patient healthy, right? Now, while you're doing your exam, I want to make sure that you're not using complicated words and words the patient may understand. So you turn to your dental assistant and say, hey, I need a root canal on tooth number 19. We're going to need bone grafting on number 30. The patient is going to hear that and they're going to start thinking with it, right? And you don't have the chance to talk to them right now because you're still doing the exam, but in the patient's mind, it's all rolling. So you want to make sure to have good abbreviations. In our office, we use abbreviations. So I may turn to the dental assistant and say RCT 20, EXS, which is extraction surgical, number 19. If I want a consult, I say endo, and she'll know it's a consult with the root canal specialist instead of endodontic consult or oral surgery consult. So we use a lot of abbreviations, but what I will do is I'm going to tell the patient, hey, I'm going to do a full thorough exam. I'm going to speak to my dental assistant in code because she knows what that means and it helps us do this efficiently. But I will make sure to explain everything I'm telling her to you right afterwards. So now the patient is not in some mystery trying to figure out what you're saying. They're just letting you do your exam and they're waiting for the results. So that's a very important step. Now, we're going to cover the actual treatment presentation in other tips videos, so make sure you look for those. But what I will say is after you're done with the exam, make sure you have the time to actually present the case. And as soon as you sit the patient up, don't let them bait you into giving them a price. The doc, it's bad. How much is it going to be? Just give me a price. I'm not going to hold you to it. They will hold you to it. So you want to make sure you've really formulated your treatment plan, you have it down exactly the way you want, and you have enough time to speak to the patient about it, right? So the keys for a good new patient exam is 1, set a great first impression, which includes having a clean room and going in and really greeting the patient and making good contact with them. And then get all the data you need, be thorough, be comprehensive, and then make the ideal treatment plan, and then you're going to present it to the patient. So that's my tip for this week on doing a great, efficient new patient exam that's going to help you close cases. Please, subscribe if you want to see more tips. We've got such amazing information for you, and I'll see you for the next one.